Good afternoon. We're going to go ahead and start the webinar today. My name is Zach Gibson, and I will be supporting today's webinar with our host, presenters, and moderator, who you will meet shortly. On behalf of Prevent Child Abuse Florida and the Department of Children and Families, welcome to today's webinar on bringing protective factors to life, concrete supports in times of need. We thank you for taking the time to join us, and we look forward to your participation. Please be advised we are recording this webinar and will make it, along with the presentation slides, available on Prevent Child Abuse Florida's website at www.preventchildabusefl.org. Please also know that we are here in Tallahassee under a tornado watch, so we hope that it won't create any technical challenges, but we are ready to go in the event that it does. Our host and to provide today's welcome, here's Mr. Chris Lally.
Thank you, Zach, and hello, everyone. First, I just want to say thank you to Zach and Jessica from the governor's office, to Sarah and Wes and Waleska and everybody from the Department of Children and Families, along with Maria Long, our certified Be Strong Families trainer. We're glad to have you with us today. As Executive Director of Prevent Child Abuse Florida, first, I'd just like to say we miss you. You know, normally during April, we get to travel the state to tell you how much we appreciate your work, that you do so much good with working with the children and families that you work with. We come out, we attend your Pinwheels for Prevention events and help you support them. Sadly, however, this year that's not possible. But we've adjusted. We found new ways like this to provide education, resources, and other ways that we can maintain our connections and continue to help you help families. Most of you know, during times of crisis and stress, incidents of abuse and neglect can increase, domestic violence as well. We want to do our part to stop that from happening. So whether you're going through or we're going through a pandemic, or a hurricane, or whether we're dealing with any other number of issues facing families on a regular basis, like poverty, job loss, any other stressful situations families face. Fortunately, we have some tools to help us tackle these challenges. These tools are called protective factors. Today's webinar is the third in a series of 5 webinars we're co-sponsoring, focusing on the protective factors. We've covered resilience, a protective factor all parents need, social connections, needed now more than ever, and today we're going to focus on concrete needs. You know, there's no substitute for concrete needs when we need them. And today, not only will you hear more about what they are, but we're going to provide you with information and ideas for how to get those needs met or how to help others get their concrete needs met. You're going to be encouraged to share responses to questions that we pose throughout today's webinar by typing in the questions box. We're going to pause after each question so that our moderator, Janelle, can share some of your responses. We also want to encourage you to use the questions box to share your comments that you may have throughout the webinar. Over the past 5 years that I've been privileged to be at Prevent Child Abuse Florida, and together with our partners, we've talked a whole lot about adverse childhood experiences, or what we call ACEs. What we want to talk about and what we want to propose that those are replaced with are what we could call PCEs, or positive childhood experiences. These are critical for children to develop the tools they need in order to become successful adults. We all know ACEs can negatively impact brain development in young children and result in future physical and mental health challenges as well. Most of us are familiar with risk factors, or at least we've heard of risk factors. But sadly, most of us possess them, but many people are not familiar with the protective factors. We provide these informational webinars with the intent of hoping you'll be able to gain some insight into your own life, or perhaps more importantly, so that you can help somebody else. So please be sure to share this information with your family, your friends, and your networks so they can become aware of and strengthen their own protective factors. And now I'd like to turn it over to our two dynamic presenters for today, Ms. Sarah Shepard and Ms. Maria Long.
Thank you, Chris, for your leadership and for that of the Department of Children and Families and the Governor's Office. We are utilizing a community cafe model for this webinar, and we appreciate the opportunity to share information on protective factors and how they can reduce or eliminate all kinds of risks. So a little background on myself. I'm a mother of 4 wonderful children. I have great faith, and I will have 10 years of long-term recovery with substance use disorder and mental health struggles. In 2010, I delivered a baby who was born substance exposed, and at that time, all of my children were removed and placed with family members. I have received services from Florida's behavioral health system, and now, thanks to God and recovery, I have had the opportunity to become a part of the healing of our system. I was introduced to the protective factors in the 4th year of my recovery after having suffered several traumatic events while clean. I found out about the community cafes offered Start in Volusia and Flagler, and eventually began to work for them as a parent leader, working with parents whose children had been removed. The organizational framework of Healthy Start is based upon the protective factors framework, focusing on what is strong with families and not what is wrong. I was able to see how they could help break cycles, not only within the lives of the families we were serving, but within my own family and children as well. My children had a number of adverse childhood experiences as a result of my own adverse behaviors and coping skills, and knowing that protective factors are teachable helps me to feel comfort in knowing that by implementing them into our daily lives, I am supporting my children by reducing their risks and supporting them while they are on their own journey of wellness. I truly believe in the power of the protective factors. I would now like to turn it over to my colleague, Ms. Maria Long.
Thank you, Sarah, for sharing your personal story and the importance of protective factors and the impact that they've had on your life. My name is Maria Long, and I'm the mother of 2 amazing grown children, Nicole, 41, and John, 31, and 2 grandsons, Wanda, 2nd, who is 12, and Jameson, 2. I was blessed to have been trained in the protective factors in 2013, and since then have been teaching them to organizations, community groups, families, caregivers, and churches. The protective factors have changed the way that I parent my grown children, but most certainly the way that I interface with my grandsons, and all in a positive way. I would recommend learning about and integrating these protective factors into your daily lives so that you too can become better parents, grandparents, aunts, uncles, and caregivers. And I will now pass it to our next presenter, Mr. Zach Gibson.
Thank you, Maria. My name is Zach Gibson, and I have the honor of serving as our state's Chief Child Advocate and Director of the Governor's Office of Adoption and Child Protection. When I came into my role in 2012, I remember hearing about protective factors, and the first thing I did was did a self-assessment to see where I was with my protective factors. Now, when I hear of challenges and issues across our state, I always think about which protective factor can assist in resolving these issues. This has served me well and encourage each of you to consider doing the same. I now want to pass it to our moderator who will be managing your comments and questions during today's webinar, Ms. Janelle.
Hi, good afternoon, everyone. This is Janelle King. I'm the Interagency Youth Engagement and Restorative Practices Specialist with the Office of Child Welfare at the Florida Department of Children and Families. I'm happy and excited to join you all today in our 3rd part series of our webinar, and I'm here to help and support with any questions that come up and moderating the polls as well. So thanks, everyone. And with that, I will go ahead and we'll start our first question. As we do on all of our webinars, we like to hear from you all. So if you can go ahead and type in the question box, it's located on the right side of your screen. We already see your name, so if you just want to go ahead and type in which county you're from, and if you're representing an agency, what agency that is, or maybe you're representing as a community member or a parent. So let us know all that apply for you. I see someone's from Alachua, someone's from Brevard, St. Lucie County Counseling and Recovery Center, lots of Guardian Ad Litem staff coming in, Polk, Guardian Ad Litem 8th Circuit, Gainesville, Florida Partnership for Strong Families, Guardian Ad Litem volunteer, Santa Rosa County School Board, EHS, Head Start from Brevard Public Schools. We have Volusia Healthy Start Coalition. We have people from all over the state. Holmes County Substance Abuse and Mental Health. The people are pouring in their responses. Brevard Head Start Family Advocate, Sarasota Centerstone, Jacksonville, Osceola, 9th Judicial Circuit. So thanks everyone for joining. We have some SEDNet folks on, lots of various partners and people joining us today from all over the state. So thanks everyone. I will go ahead and hand it over to Maria.
Thank you, Janelle. And it sounds like we have a fantastic group of folks joining us today. Since we're going to be hosting this Strengthening Families Protective Factors, Bringing Protective Factors to Life webinar virtually and not in person, we still want to share some conversational norms or expectations with you. The first norms talks about speak from your own experience, speak your truth. So this really goes to the notion of using I statements because no one can tell your story better than you can. And we hope that you are comfortable enough today really to speak and to own your own truth, knowing and trusting that your voice will be heard and that your contribution is definitely wanted and respected. Our next norm talks about listening attentively and deeply. So we really talk about an opportunity to really look what's beneath the words. Listen to what's being said. Listen to the feelings. Listen to perhaps the intent of what that person is trying to share with you. And we hope this will help you strive to achieve a balance between listening and reflecting, speaking and acting. We ask that you would suspend judgment. Set aside your judgments, whether they're positive or negative, it doesn't matter because judgments can sometimes get in the way of what's being said. So we hope by you suspending those judgments that we are creating a space between those judgments and perhaps our reactions to what is being said and what's being shared. We want to be able to listen to each other and to ourselves more fully. We talk about maintaining confidentiality, creating a safe space. The stories that we share will stay, but the lessons may leave. So we're really talking about we want to create an emotionally safe place. So these will be our conversational norms as we go throughout our webinar today. The change is now. There's a quote given by a doctor by the name of N. Scott Peck, and the quote goes as, "The change is now." The truth is that our finest moments are most likely to occur when we are feeling deeply uncomfortable, unhappy, or unfulfilled. For it is only in such moments, propelled by our discomfort, that we are likely to step out of our ruts and start searching for different ways or truer answers. And this quote actually comes from a book written by Dr. Peck during the 1970s. It's a book that lots of folks have read, and it talks about the road less traveled. And in that book, he really talks about how is it that we look into our inner strengths to help us really to successfully navigate change. Wonderful book. I would recommend it to anybody if you have an opportunity to get it and to read it. So let's talk a little bit about change. We all know that change is inevitable. However, how we see and respond to change is really what makes the difference. We all know that change can be challenging and difficult, particularly during times like these. However, we also know that change can allow us to see and to do things differently. Change provides opportunities for growth and exploration. for formulating new goals and plans, and for gaining a better understanding of who we are and our purpose in life. This can bring about better solutions and outcomes for ourselves, our families, and our communities. I've also included another quote, and this quote once again talks about the fact that change is now. So this quote says, to the world, you may be one person, but to one person, you may be the world. So we've included this quote. We just want you to understand just how important you are. Each of us can make a positive difference in the lives of our children, our families, and our communities. We don't always know when opportunities will present themselves, but if we can build and implement protective factors in our lives, we will be better prepared to be the world to the people who are counting on us. So let's learn more about the Strengthening Families Protective Factors framework as the tools that will aid us along family journeys. So tools to navigate the change. So at this point, we're going to have a poll question. So I'm going to turn it over to Jessica, if she could please do our poll question.
Sure, here you go, Maria. So we are curious, are you familiar with the Protective Factors framework? Perhaps you've attended some of our previous webinars, so maybe you already have been familiar. As a reminder, last week's poll came in at 48% of people said yes, and 52% of people said no. You can actually answer the poll right on your screen, not using the question box, just the poll right on the screen. So we'll give it about 3 more seconds, and we will close out the poll. And I will share the results. So 65% of people said yes, and about 60% voted. So roughly, if I'm doing math very quickly, that's about 100 people or so know about the protective factor, and about 40 people do not know about the protective factors. So I will go ahead and hand it back to you, Maria. Thanks for
Thank you, Janelle, for sharing those results. And actually, the number went up from last week in terms of individuals that are familiar with the framework. So that's absolutely fantastic. So protective factors can help us to be the best parents that we can be each and every day, and especially during this time of uncertainty. The Strengthening Families Protective Framework is strength-based and seeks to help families identify their current parental strengths, as well as areas in their parenting which present challenges and what I call opportunities for improvement. Sarah said it so. In addition to strengthening families, information on protective factors are an important part of reducing the risk and the ever-present danger of child abuse and neglect in our homes, our communities, and across this nation. So what are these protective factors? There are 5 protective factors which can be translated into everyday language. The first protective factors talks about parental resilience, which was part 1 of our 5-part series, where it talks about being strong and flexible. And when we spoke about that, it really talks about our ability to overcome adversity in spite of all the things that may be going on. We talk about the power of social connections, where it talks about parents need friends, but we really talk about beyond that, parents need healthy and supportive and caring relationships. Today, we're going to be talking about concrete support in times of need. We have some absolutely awesome and wonderful information for you, but it really boils down to everyone needs help sometime. So hopefully you're going to learn how is it that you can go about and secure that help. We talk about knowledge of parenting and child development. That is really a 2-part protective factor. Part 1 talks about being a parent is part learned and part natural. And the other one really talks about our ability to understand our child's development, otherwise known as ages and stages. And that's what we'll be talking about next Thursday at the same time. Then the last one that we were doing in our series, we talk about social and emotional competence of children, and this is really the only protective factors that really focuses on our children versus the parent. And it talks about, though, that we as parents need to make sure that our kids understand and are able to communicate effectively. So today's webinar, as we already mentioned, will focus on concrete supports in times of needs. Everybody needs help sometimes. This protective factors framework has been in existence since the early 2000s, and was really created by the Center for the Study of Social Policy. And please note that when the original study on this protective factors framework was done, the protective factor on nurturing and attachment was a standalone factor. However, the framework has since been updated to identify the importance of social and emotional competence of children, with nurturing and attachment included in all of those 5 protective factors that we just spoke about. Prevent Child Abuse Florida embraces all of the protective factors and recognizes that nurturing and attachment as a 6th standalone protective factor because of its importance in the relationship between parent and child. When these protective factors are strong in families, we know that children are safer and families are healthier, happier, and better prepared to manage stress and the change that is going to come in their lives. Families need all of these protective factors, and we can always be building the protective factors in our homes and in our lives. Many of you are already building these protective factors in your lives without even knowing it. It was probably something you did because it made sense. It helped you to achieve some goal that you had in mind. So today, we want to make sure that you understand the power of these protective factors, how they help us to be better parents, to be great parents, and once again, what's our goal and objective? To have healthy, safe, and trusting relationships with our children. So what are protective factors? Protective factors really have 2 primary functions. One is to reduce and eliminate risk, and with the second one is to promote the healthy development and well-being of children. The definition says what? Attributes or conditions of individuals, families, communities, or the larger society that A, reduce and eliminate risk, and promote healthy development and well-being of our children and families. When we use these protective factors, we are helping to ensure that our children perform well in a multitude of settings and environments in which they will find themselves on any given day. Protective factors can help you identify healthy and constructive ways to deal with the stressors in a way that will help you be a better parent, caregiver, and person. Stressors which can include situations like not being able to pay our bills, losing our jobs, perhaps the lack of food, shelter, clothing, and transportation. These are all situations that cause stress in our families, or perhaps even dealing with a current or a past addiction, perhaps dealing with physical and or mental issues, or just being part of an unhealthy relationship. So what do we know about protective factors? We know that families thrive when protective factors are robust in their lives and their communities. So we hope that you will commit to learning about and bringing these protective factors into your life. So how do we build these protective factors, you might ask? Well, first and foremost, we must take care of ourselves and ensure that we are healthy. And when I talk about being healthy, I'm talking about physical health, mental health, emotional health, behavioral health, and spiritual health. We need to make sure that we are healthy in all of those areas, because if we are healthy, then we can be healthy and reach out to others and take care of them. If you look at the self-care graphic that's right above on the right top of the screen, it identifies such things as communities, priorities, choices, kindness, pleasure, slowing down, curiosity, and exploration. They're just saying these are some of the facets of self-care. And keep in mind, this is not a self-inclusive list, but it's certainly one to just kind of make you think, what are the things that I need to do to make sure that I'm taking care of myself? Once again, physically, mentally, emotionally, and spiritually. To build these protective factors, we need to make sure that we identify our parental strengths as well as our areas for improvement. And we need to develop a plan to enhance the strengths that we have and also to address those needs or areas that I call opportunities for improvement. I know that sometimes making a commitment can be hard, especially if it's talking about totally changing what you do or doing something a little bit different. But let's discuss what we talked about on some of our previous webinars, how these protective factors are really tools that can help you follow through on those commitments. Building a healthy relationship with each of your children is necessary so that you will be able to understand and to address their unique needs. I tell people all the time, the greatest gift that you can give to your child is knowing your child. Every child that you have is unique and different and just beautiful. Take the time and the energy to know your child. How you respond to and react to situations will model and influence how your children may respond and react as they become older. So today, we're going to talk about and give you a very high-level introduction to the protective factor called concrete support in times of need. This protective factor really talks about the fact that at some point in all of our lives, we will all need some kind of concrete support. Keep in mind that help or support may look differently or feel differently for each of us depending on the situation. It could be the need for food, clothing, housing, or even financial assistance, or it could be the need for medical assistance. Each person and family has their own unique set of needs and circumstances and support systems that may or may not be available to them depending on that need. So today's webinar will provide you with valuable information and resources that can assist your efforts to access concrete supports when the need arises. Concrete support in times of need. So when we talk about this thing called concrete support in times of need, what exactly do we mean? It means that we must ensure that our families have access to concrete support and services that address their basic needs, as this is one of the most important roles that we play as parents and caregivers, providers for our families. It is important that to the extent possible, we help ensure that families know about and are linked to programs and services in a way that shows them that we are supportive of and care about them and the needs of their families. We must be careful to look at our own judgments and biases to be sure that they don't come into play when we are helping parents and families meet their needs. We must be mindful of the way that we support people and the words that we use when we offer up this thing called help. There's a saying which states, sometimes it's not what you say, but it's how you say it. Personally, instead of asking them, can I help you? I ask people, how can I support or assist them? You would be amazed at the way that people respond differently just to the words that I use when I bring myself to the table. Always keep in mind that we are here to be part of the solution. And in that vein, we should always strive to be mindful and respectful of our families in their parenting journey. So what are some examples of these things we're talking about concrete supports? Concrete supports can be in a multitude of different things. It might be food, the need for food, once again, the need for shelter, clothing, perhaps transportation. It could be access to something they need in terms of addressing their physical and emotional and developmental and behavioral health. It could possibly be something in terms of they need to understand the difference. Once again, we talked about last week, social connections, the difference between those healthy connections and those unhealthy connections, and how that's so important that we bring that to the table and what those individuals can do in terms of helping us meet our concrete support in times of need. Or it could be finances. This is not an all-inclusive statement, but it really gives you an idea of some of those very basic needs, once again, that our families need to be able to have a fulfilled life. Janelle, could I get you now to share our next question?
Sure. Thanks, Maria. So we'd like to hear from you. And if you want to go ahead and type your response in the question box to this question. And as a reminder, when we talk about concrete supports, we're really referring to, like Maria just mentioned, things like food, shelter, clothing, transportation, physical health, emotional health, developmental health, behavioral health, relationships, and finance, just to name a few. So we'd like to hear from you. If you've ever experienced a time when you've needed to access concrete supports like those things we just mentioned, or maybe some other things that we didn't mention, where did you go for help? Someone mentioned Brevard Cares. 211, yeah, those big resources, those big hubs. Family and Church, Bridgeway, utilized food pantries, early steps for this person's son. Catholic Charities, EAP services, a private counselor. Someone says United Way, someone says a community health center, Access Florida, that's great. Community action programs, another person said EAP, Friends of Foster, someone said United Way, Goodwill, spiritual support, mental health counselor, Head Start Blue resource card. Another person said mental health counselor. Family, those are all great concrete supports that exist. Yeah, DCF, case management, local food banks. Awesome. Thanks everyone for sharing. I appreciate it. And now we're going to hand it over to Miss Sarah Shepard to share some more.
Thanks, Janelle. All right, so as Maria was mentioning in the previous slide, when we're discussing concrete support in times of need, meeting the basic needs of individuals is of importance. So we would like to take a look at Maslow's hierarchy of needs and how it connects with our protective factor. Looking at the diagram, you can see that Maslow's diagram lists that physiological needs are at the base, and meeting them is the first in the steps that it takes to reach self-actualization, where change becomes possible. Maslow states in his theory that we all have physiological needs as the foundation of our journey, and that food, water, warmth, and rest are the needs that are non-negotiable. In addition, we all have safety needs, both emotional and physical, that are necessary to move to the next level. So to paint a picture of connection for you, I will give you a personal example of how important concrete support in times of need are for families. So when children are removed and a dependency case is opened, a parent has approximately 12 months to reach permanency. And before I talk about my experience and my story, I'll state that research has shown that permanency is extremely important for the well-being of a child, as is the child being with its biological family when safety for the child is met and when possible. So when my children were removed, it took almost 30 days to get a case plan going. And so I had just a few months to check all of the boxes. I was told to go to therapy, parenting. I had to maintain stable employment and safe housing. Having a criminal record as a result of my adverse behaviors, it was most difficult to obtain work and housing. I knew that if I didn't have that, I would be deemed an unfit parent. I was unable to obtain housing while working for minimum wage. I had to pay child support. I had to pay my current living expenses. I had to pay my therapy fees for food and court fees and transportation. So finding first, last, and security for a home was nearly impossible. And I actually lost custody of my older two children who went to live with their dad, who was a non-parent, when I had 6 months clean. Thankfully, I had made some positive social connections who had helped me to connect to a housing program, which was Section 8. And that would allow me the opportunity to bring my little two home. My positive social connections helped to link me to the concrete support that my family needed in order to get back together. As the years went on, I eventually became more self-sustaining, going on to obtaining a state certification and 2 top college degrees, which helped to get me to where I am today. As I got better, my older two children were able to return home, and I eventually regained custody. Not every parent and child will have the same outcome, and families often become broken due to a lack of resources to meet their basic needs. As a mom of 4 with a college education, it is still difficult to make ends meet. This is not unique to parents in the dependency system. I still need to ask for help sometimes, and I still need to know where to go when my family needs concrete support. So until my basic needs were met by at the bottom of the pyramid, I couldn't even focus on the real internal change that was needed and that was expected of me. And that was the way to really, and reaching that self-actualization is really the way to break those cycles. So the basic needs for families are important, and the framework of the dependency system emphasizes the importance of being able to meet those physiological needs in order to meet your family's needs. You must have food, water, warmth, and rest to provide a level of safety and security for your family. But when families lack the knowledge of the resources or concrete supports that are available to them, or when none exist, many families experiencing struggles that can become permanently broken, and those broken cycles will most likely continue for generations to come. I once met with an individual who was no fan of anyone working in the system. She had experienced multiple horrific traumas as a child. Her adult trauma response and adverse coping skills were evident through the multiple situations that were reported on drug use, mental health, and behaviors that created an unsafe situation for herself and for her child. As her child was placed into foster care, we worked with her to support her in her journey of retaining her rights to her child and to support her as she worked to restore her family. On one of the first occasions that we met, I noticed she was unable to look at me or to even focus. I decided to put what was supposed to be done at the appointment down and really just talk to her as a person to find out what was going on and what I could do. She told me that she was hungry. She told me that she hadn't eaten in a week. I knew she was struggling with homelessness and was sleeping in the heat on the concrete. At that moment, I dropped what we were doing. I did what I needed to do to get her food, and she began to open up to me about her struggles. I was able to engage with her, and she was willing to be honest through the time we worked together. Honesty is an important step in being able to ask for real help and to reach self-actualization. What I learned is that people cannot hear us when they are hungry. They cannot hear us when they have been sleeping on the concrete in the extreme heat, cold, or in the storms. And if people cannot hear us, we cannot truly help them. So if we have parents who are showing up, whose lives have been reduced to basic survival and living skills due to their experiences, it is our responsibility to help find ways to educate on the concrete supports that are available and to point out how resilient they are and how much they must care about their family to just keep showing up even in the midst of so much adversity. It is important to recognize that people cannot meet self-actualization without being able to access concrete support in times of need. And we cannot support families to help break cycles to raise healthy children without being able to provide information for families on where they can go when they need the help. Concrete support is who we can go to when we need help. I will now turn it over to Zach so that he can talk about some of the concrete supports that are available to you and those individuals that you are supporting.
Thank you, Sarah, and thank you for sharing those powerful stories. The information I will be covering will focus on important needs and is certainly not an all-inclusive list. The slides being discussed are available in the handouts tab that's on the right side of your screen. That will enable you to view and actually click on the images to access the websites of where information can be found. I want to reinforce something my colleague Maria shared in an earlier slide, that when you're seeking concrete supports, you have to be persistent and have perseverance. We know it's not going to be easy, and many times where we look for information, we get closer and closer, searching for that answer of yes, we can help you. So again, the importance of being persistent and perseverance is really key. So I'm going to start with this slide, and this information talks about COVID-19 in the state of Florida. Hopefully many of you are very familiar with this already. But what's great about this information from the Department of Health, that it highlights what are the protective factors to mitigate against the risk of COVID-19. Hopefully many of us now are familiar with those protective factors of washing our hands, practicing social distancing, now wearing a covering over your face if you're going into public. These are all protective factors that can help mitigate and prevent the risk of contracting or even spreading COVID-19. So this information on this slide has a lot of great information on the website. I encourage you to certainly familiarize yourself, but also to share it with your friends and families and loved ones. City and county governments offer a lot of services, including local information on COVID-19. While the state has issued some guidance related to COVID-19, some local communities have implemented greater restrictions around protecting against the risk of infection and transmission. So this slide provides you a link to all 412 city government websites in the state of Florida. And then the directory for the counties provides you actual contact information for representatives within counties who provide a lot of social services and general services within each county of our state. So again, if you download the handouts, you will be able to click on these to be able to see the information on there. And a reminder that all of these slides will be available after this presentation that will also be accessible to click on to be able to be taken to those respective web pages. We had heard 211 identified as one of the places some folks may go, and let me just say 211 is an amazing resource in the state of Florida. Many of the 211s are connected to the United Ways of Florida. The image on the left, if you, after reviewing it, if you happen to click it, it will take you to the listing of all the 211s throughout the state of Florida. And the information on the right provides you a dashboard to various 211s. It's not to all 211s in Florida, but to various ones where you can see information on the types of calls received, the zip codes where the calls are coming from, and information about the zip code to include poverty rates, education rates, and unemployment rates. So there's a lot of great information on this 211counts.org website. And certainly, too, want to reinforce the value that 211 plays within our communities to be a direct connection to assisting individuals and families access concrete supports. Food is definitely an important need, and as many of you have heard in the news, there are many groups stepping up to address the hunger needs within our communities. In Florida, we have a great network of food banks who work with many partners to get food from their warehouses to locations throughout communities in the state of Florida. Packing house may be a new term to you or a term you're unfamiliar with, and it represents what FarmShare does as they repackage fresh fruits and vegetables for distribution in communities many times, all the time at no cost. So our food banks, and certainly FarmShares included, all provide a great resource. When you download the slides or the handouts that's provided to you, you can actually click on the agency, and following their website, you'll be able to locate specific locations within your communities where food is available. The Department of Agriculture and Consumer Service has some great programs to support the hunger needs in Florida. Each box will link you to the agency's description of the program and the contracted agency responsible for administering food associated with the program. The Temporary Emergency Food Assistance Program, otherwise known as TFAB, is a great program that provides food at no cost to Floridians who are in need. And the Commodity Supplemental Food Program is specific for seniors or those over the age of 60 who may have needs for food. We also wanted to share information about the Summer Break Spot program. With summer right around the corner, the Summer Break Spot program provides healthy meals for children in communities throughout our state during the summer. In addition to the providing a description of the program, you can also access the map where you can see where summer meals are being provided in your community. The Department of Health also has some important programs to include the WIC program, the Women, Infants, and Children program, as well as the Child Care Food program. Many times those are provided for after-school programs. Again, by clicking on these links, you'll be able to access a lot of great information about these programs, as well as to figure out who are the agencies providing information and how you may apply to become a provider of these services. Housing is certainly another important issue in our state. The images that we've provided will link you to the websites of the page of the agencies to access information and resources on homelessness, affordable housing, and on government vouchers. City and county governments are also a great resource that can help with rental and utility assistance and refer you to community organizations that can further assist in times of need related to housing. So there's a lot of great information. I wanted to highlight the HUD website also has additional information beyond housing related to food and certainly clothing and other resources that are needed for those who may have that need. The Department of Children and Families provides various concrete supports to assist families in their transition to self-sufficiency. The images that we've provided here will connect you to information on temporary cash assistance, the Supplemental Nutritional Assistance Program or the food stamp program, and health insurance through the Medicaid program. The department also has various ways to connect to information on these websites, either directly through the myflfamilies.com website or through myflorida.com is another way to access information on the services and supports available through the Department of Children and Families. Keeping with health insurance, we wanted to share information on the Florida Kid Care program that provides 4 health insurance options to assist families. By clicking on each of the box, that will take you to the web pages of the agencies that administer those respective programs. A lot of great information. Certainly now could be a great time for families to really reassess where they may be at with their health insurance and see if there's a more cost-effective option available through Florida Kid Care that can help them in their financial stability. There's been a lot of talk about maintaining mental health and wellness of Floridians as we work through this pandemic. The Department of Children and Families has information on their website that provides a lot of great information and resources to assist families who may be experiencing substance abuse or mental health challenges. The federal substance abuse mental health website that's provided on the right side of your screen also provides a lot of great information, including identifying programs throughout the state of Florida that can provide behavioral health services to those who may be in need. In Florida, the Department of Children and Families contracts with managing entities who provide behavioral health services within our state. By clicking on these images, it will take you to the department's webpage where you can access information about each of the managing entities. The websites for the managing entities have a lot of great information, including various concrete supports that assist individuals becoming productive and self-sufficient. We know having financial stability is key for every family. We provided some links to organizations in Florida that can assist individuals and families with their financial stability and security. There's great information on the Career Source Florida website that describes what they can offer in connection to each of the Career Source offices throughout the state of Florida. We also wanted to highlight information from the Division of Vocational Rehabilitation through the Department of Education that can assist individuals with disabilities with job skill training and placement services. The Department of Economic Opportunity has also created a resource guide for reemployment assistance, and we encourage each of you to review and share this information to those who who could benefit from this information. So at this time, I want to kind of bring us back to the definition of concrete supports in times of need. Now that you've heard about that, again, the handouts, if you download those, they have, you will be able to click on those images to be taken directly to those websites for additional information. And certainly our slides at the end of this presentation will become available, and each of the slides will also have the links connected to them. So at this time, though, we wanted to get your thoughts about a question with the following poll question. So Janelle, can you assist us with this, please?
Sure, thanks, Zach. And just wanted to let people know the poll is now up. We're curious why you think it's hard for people to ask for help. Often, this can be a challenging thing to do, and we're curious to hear from you all. You can select multiple answers, so go ahead and get your answers in. Some of the answers involve pride or shame, fear of judgments by others. Another answer that we have is we don't always recognize when we need help. Another response is people may not have anyone they trust to ask. Another answer you can select on the poll is sometimes we're unsure where to go to or we don't know who to ask. And another one is a belief in self-reliance. So go ahead and get your answers in on that poll. We'll leave it open for a few more seconds. I see 42% of people have voted, so I'll wait just another 5 seconds or so. All right, so about half our group voted. 81% of people selected that they think it's tied to pride or shame, possible fear of judgment by others when asking for help. The next most populated answer was D, we're sometimes unsure where to go or we don't know who to ask. The next most populated answer was the second one, we don't always recognize when we need help. 63% of people selected that. The next one is 51% people may not have anyone that they can trust to ask. And 43% of people selected a belief in self-reliance. So I will go ahead and pass it back to Maria. Thanks everyone for sharing your responses on that.
Thank you, Janelle, for managing our poll and sharing the results with us. And really want to give a big shout out to Zach for sharing all the great information in terms of how we can possibly identify and secure resources both within our state and specifically within our cities and within our communities. So this African proverb says, when spiders unite, they can tie up a lion. And it really talks about our unity in terms of us working together to overcome whatever the enemy or the foe may be. And in this case, it's making sure that all of our families have all of their basic needs met. So just think about this proverb, when spiders unite, they can tie up a lion. Think about how powerful we are in terms of when we walk and support each other on this journey of parenting. So as we begin to wrap up this webinar, we hope that you will reflect on today's experience. We have another poll and we'd really like your feedback on how today's experience has impacted you. So I'm going to turn it over to Janelle once again.
Awesome, thanks Maria. So we always like to ask folks, as a result of today's webinar, has your knowledge of the protective factors increased? So yes or no. And I know some people use the audio option, so they're unable to share their responses, but if you prefer, you can just type it in the question tab if you are not able to answer on the poll. We've got several responses yes in the questions tab. We'll still go ahead and collect responses in the poll if you can, though. All yeses so far in the question tab. That's awesome. Thanks, everyone. Probably 20 people typed in yes in the questions, and we'll go ahead and close the results on the poll. So an overwhelming percent of people said yes. That's great that your knowledge has increased as of the webinar today. So thanks, everyone. I think I'm going to hand it over now to Sarah to talk about how we can bring protective factors to life in our communities.
Thank you, Janelle. So community cafes are one way that we can bring protective factors to our communities for meaningful conversation and learning. There's no focus on where you're at in life or who you work for, but instead, what's important is the experience, strength, and hope that you can bring to the table as a parent. As parents, we can learn from others on how they implement the protective factors in their lives, and we can use that information to learn new ways to implement them in our own lives. By partnering together, we can work collaboratively to create a community that suspends judgment and focuses on strengths. We are working with multiple stakeholders and collaborating across systems to bring the protective factors virtually to offer support to families in each of Florida's regions. If you are interested in bringing the protective factors to life in your community, please contact Chris Lawley at Prevent Child Abuse Florida. Now, before we end this webinar, we wanted to respond to some of your questions. Janelle, can you assist us with this?
Sure, thanks, Sarah. So we want to offer the opportunity to answer any questions that you may have at this point. So again, if you can use the questions box and share any questions that you may have for our team as it relates to concrete supports in times of need, or maybe about previous protective factors that have been discussed on the prior 2 webinars. So we'll give it a few seconds, and as questions come in, I'll field those and put them back to our presenters today. We'll do our best to get to as many questions as possible, and we encourage you also to email Chris Lawley if you're seeking any assistance. So we'll give it a few more seconds. If there are any questions, we'd be happy to take them. We have lots of time left. Someone just has more of a comment than a question. Marcia's mentioned that it's really frustrating for a caregiver or parent when they are not able to access the concrete supports. She said it's not a question, but just a fact for her. And hopefully the slides that Zach was able to provide will be able to assist you with that moving forward. Someone says agreed. Another person, Anna, has where exactly will we be able to find the recordings? All the recordings will be available at preventchildabusefl.org. On the last slide of the presentation this afternoon, you'll see the website there as well. We have another question from Tina, a question from Tina that came in. How do you overcome the barriers to getting people concrete supports? So do any of our...
I'm sorry, Janelle, this is Zach. I'd like to take a stab at this question. Tina, thank you so much for your question. And I think it's certainly a challenge as we think about how do we overcome barriers. I think first and foremost, our ability to establish a rapport and relationship is key to our ability to help someone. Again, knowing that if there's no trust or any connection associated with our ability to support and address that need, we won't even get any further than just offering the questions that we may have of someone. So I think, for me, I think it's really around building rapport and relationship, certainly building a level of trust that the other person can feel so that they can be open and honest about their situation, and we can better understand what they may be going through and how we may best to be able to offer support for them.
Thanks, Zach. Let's see, we have several more questions that have come in. I'm trying to read them as they come in. Someone asked, in terms of the barriers mentioned in the survey, how would a home visitor help a family if they have the self-reliance belief? In other words, the self-reliance belief of does not need help.
Janelle, this is Zach again. I'll go ahead and respond to this one. I think, it's hard sometimes for individuals to recognize when they may need help. And I think certainly as a home visitor, your ability to work with them, certainly building trust, is definitely the first thing I think needs to happen. And I think as you are working with the individual or family that you're trying to help, helping them through your questioning, I think motivational interviewing is always a great approach to presenting situations and information to challenge someone to think about how they may react or respond to situations. And based upon those responses, I think that opens the door for opportunities to help identify where there may be a barrier that you can assist that individual with in helping them overcome that.
Hey, and Janelle, this is Sarah. I just wanted to also try and provide some feedback, but so I think sometimes as someone who used to do some home visiting, it was more well received when I offered support, when I talked about the times that I needed it myself in my own family. So kind of humanizing myself instead of really just looking like somebody who's wearing a badge coming into your house. And so like using mutuality was helpful. And then there were other times where people still just didn't want the help. And the truth is we can't force anyone to take any support. And so one of the things that I would say, which I learned from my old executive director, is that, this is your life and you have the opportunity to live it how you want to. And so, if you want the support, these are the things that we have available to you. And if you're not ready now, they will be available when you are ready. And so those were kind of some of the ways that I would talk to individuals when I went into homes.
Thanks, Sarah. We had a follow-up question for you, Sarah, or maybe not so much a follow-up question, but a question geared for you. Can you address the 5 stages of grief that our parents go through once their kids are removed? And then Irina had another question. She also said, great work, wonderful story, by the way.
Thank you. So I can't really address all 5 stages of grief, but I mean, it's definitely something that as those who are delivering services need to be aware of. If a child is removed from a home and a parent is angry, that's pretty normal. That's a normal reaction to have. And a lot of times parents are called defiant, or they're made to go see a psychiatrist or a psychologist. And so a lot of times though, that is a normal reaction to having your children removed. And so really just kind of supporting the individual with some services. There are some groups in different areas that actually have people who have gone through the system who work with those parents as they go through those stages of grief. So kind of like the mutual peer-to-peer support in helping those parents kind of overcome those times.
Thanks, Sarah. Her follow-up question was, how do you get over some of the denial and anger and finally have all of your kids returned and being healthy? So do you have any thoughts or comments about that?
So I definitely lived in denial. I mean, I can really only speak from my own experience. And the truth is everyone has different levels of trauma that they have experienced before actually making it to some part of the system. And so I can't really base my story on others' experiences. But, for myself, I just, I hit a wall and I felt as if I had nothing else that I could do. And so, becoming a part of a 12-step program, that actually helped me to see and overcome some of my denial. But honestly, it takes years, even years after the kids are returned to your care. There's always constant work to do. And, I've found that it's not just with people in the dependency system. We all have our own things that we bring to the table, So for me, it was just being around positive, social support. So the last protective factor that we discussed, it was really about making those connections. And so if you're wondering how to support your families that you're working with or the individuals that you're working with, it's providing those, you know, the opportunities for positive social support. So whether it's 12-step programs, the faith community, I had a guy who did jujitsu and that became his family. And so, you know, there's like Herbalife, there are all of these groups that are positive that exist out there. And so really supporting people as they go through their therapeutic process, through their therapy, and kind of, you know, opening up the door to some of those positive social supports. And then like I have a lot of friends who are school moms, they're parents of my kids' friends, and I go to them now, you know, and so we go to each other. We're able to learn from each other. So it's really just about that positive connection. So that's how I would say to support your individual.
Great. Thank you, Sarah. Thanks for that response. Yeah, we have lots of people commenting saying thank you. I'm trying to field all the questions coming in. So I see another one. Where would you find the peer-to-peer groups contact information? If there is one, could you provide us with that?
So there are many, and it really is broken down, you know, by managing entities and by regions. And I mean, I do this, I'm a statewide employee for the department, so I can get that information for you. I'm not sure if my email is on here or if I'll just put it in the chat box, but if you are interested in finding some peer groups in your area, please send me an email and I will help.
Awesome. Thanks, Sarah. Let's see. I saw another question. Maybe Zach, this is a question for you, possibly. Jesse asked, are professionals available 24/7? I know CARES has the mobile response team.
Thank you, Janelle. Thank you, Jesse. I tried to type in a response, but I wasn't able to do so. I would like to refer you, Jesse, to one of the handouts that we've provided. And certainly you will also be able to access this when the PowerPoint presentation slides are available on Prevent Child Abuse Florida's website. The department's website has a lot of great information, including information on the various response teams that are available to assist individuals. That certainly includes mobile response. Those teams, many of them, I think if not all of them, have professionals on those teams to be able to assist and respond to the needs of individuals. So if you would, Jesse, I would encourage you to check out the handouts that are available and go down to the slides that focus on substance abuse and mental health for the department. When you click on that, there's some great information there. And then certainly too, we've also provided information about the managing entities in our state. There's a lot of great information there too. So Jesse, we would refer you to those for additional information and certainly to let us know if you have any additional questions. Thanks.
Great. Thank you, Zach. Lots of people are saying thank you for your great advocacy, Sarah, Maria, and Zach. So right now, I believe that's all the questions that have come in. If I perhaps missed one of yours, retype it in. I apologize. We'll give it another minute or so. If anyone else has any other questions or comments that they may be thinking of, you can go ahead and type those in. All right, so I haven't seen any other responses come in or questions come in, so I'll now pass it back to Zach, if that works for you.
Thank you, Janelle. And again, thanks to everyone for participating today. Thank you to Janelle. Thanks to Sarah, Maria, Chris for all the great information on the Protective Factors framework and certainly about concrete supports in times of need. We also want to thank all of you who were able to join us today for sharing your thoughts and perspectives. We're always interested in knowing what you're thinking. The information and feedback you provide can certainly have helped us further refine, improve, and strengthen the webinar series that we are trying to offer to you that helps bring protective factors to life. As mentioned before, the webinar is being recorded, and once available, it along with the presentation slides will be posted at Prevent Child Abuse Florida's website. Should anyone have any additional questions, many times as I leave a webinar, things will pop in my head. And certainly if that happens to you, please email the team at Prevent Child Abuse Florida, and they are happy to assist you in getting you connected and responding to your questions. So again, thank you so much to everyone for your participation today. As a reminder, we will have another series of webinars. Our next one is scheduled for next Thursday, April 30th at 3:30 p.m. Eastern Standard Time, and we will focus on knowledge of parenting and child development. As Maria mentioned earlier, this is really a two-part topic that we are looking to provide some great information for those who are able to join us next Thursday, April 30th at 3:30 p.m. Please visit Prevent Child Abuse Florida's website for additional information. We want to thank you again for joining us, and we hope each of you have a great evening. Thank you so much.